Hello everyone, very good afternoon and welcome back to Crack Grade B. So in the morning our session got delayed due to some technical issues, hence we are starting right now. The usual timing of this particular class is at around 10 a.m. but due to some unforeseen circumstances we were not able to cover the class at that particular time, right? So now we are going to start reading about child health. Government has come up with various programs on the child related things. Some are already the component under National Health Mission, right? So we are going to see all of it. We are going to check immunization program. We are also going to see the programs which are related to communicable disease, right? So these are all the things that we are going to be covering today. Starting with child health. So under child health, the first component that we have is Rashtriya Bal Swasthya Karyakram, right? It has got a history related to the adolescent health. Now, what we are trying to cover under this Bal Swasthya Karyakram, we are covering the child who has just born, that means from infant till the level of 12th class. If you have attained, you are in the age group till 18 years, so we are covering from 0 to 18 years. Basically, the points to be covered under these are related to whether there are any diseases or any kind of disabilities that are there in the child. Now, early interventions do have some positive effects, because what happens is if you will do the early interventions, this will lead to first identifying the problem and then leading to a solution of it. So with this particular backdrop, very good afternoon. With this particular backdrop, let's start the scheme right now. So Rashtriya Bal Swasthya Karyakram, who are going to be our target group? So our target group is start from the babies who have born at public health facilities as well as home. We are covering preschool children as well, and up to the age group of 18 years, that means till the time you have started going in the 12th class, all these children are included over here. So beneficiaries are having the age up to 18 years under your Bal Swasthya Karyakram. What we are going to do over here is we're going to find out if there are any kinds of defects at birth level, then any kind of diseases, deficiencies, developmental delays including disability, because if you will be able to identify the problems at an early stage, then you will be able to find out the solutions for them as well. Hence, prevention is better than cure. That is the philosophy on which this particular program is working. Now, what are the operational guidelines? Operational guidelines means you have decided that we are going to find out the problem at the first stage itself. But how? Who are the persons responsible for doing this? So let's see at every stages. For newborn, first of all, facility based. Facility based means if the child has been born in a government health facility, then his or her screening will be done at the facility itself. Now, if he has come out of the facility, then screening will be done at home through ASHA. Your ASHA activists, they will visit home to home and they will find out if there any kind of disease, disability or any kind of deficiency that is being visible in the child who has just born and up to till the age of 6 weeks. Now, next category of child that we have is for children starting from 6 weeks to 6 years. Now, 6 years is the age group where the child starts going to a Anganwadi. Anganwadi resembles to a play school, right, in urban setup. So in rural setup, we have come up with the concept of Anganwadi. It is there in urban areas as well, but most prevalent and most used in the rural setup. So if your child is between 6 weeks to 6 years, then screening will be happening at the Anganwadi center based screening by the dedicated mobile health team, right? We have already seen that mobile health units has to be made. Next is for children 6 years to 18 years. Now at this age, it is very easy to learn the components by adding a logic into it. So if the child is between 6 to 18 years, then where we can do the screening? Obviously in the schools, because there you will be finding the child. So government and government aided schools based screenings will be done by the mobile health teams. Now next is India Newborn Action Plan. Newborn, these are small components, right? There is nothing much into it. You have to identify what are the objectives or the aims of this particular program, and that forms the most crucial part. So let's see, India Newborn Action Program. This is implemented within the strategy of RMNCH plus A. We have already talked about it. This is reproductive, maternal, as well as your child care. Committed to globally every newborn action plan launched in June 2014. Why? What we want to attain? We want to attain single digit NMR by 2030. Your neonatal mortality rate, you want to bring it into the single digit, like less than 10. Your 1, 2, 3, 4, 5, 6 up to 9, right? So this is your single digit NMR that you want to achieve till the year of 2030. Ending preventable stillbirths to achieve single digit stillbirth by the 2030. Now, with all the states to individually achieve this target by 2035. See, one is the country average and then there are individual states performance. Like I was talking about TFR. Right? So your total fertility rate on an India level, if I talk about, we have achieved a below replacement level fertility rate, that is less than 2.1. But if I see TFR state wise, then Bihar is having a TFR around 3, right? Some states like Kerala, they are having a TFR of even below the replacement level fertility. So your southern states where the more educated, more education prevails, the TFR is below replacement. And in case of northern states, or we talk about the Assam and all these states, the TFR is higher. So individual states' performance are always differing from the national average. So we are talking about national average, or what we want to achieve. We want to end preventable stillbirth by the year 2030. Please also, sometimes what happens is in statement based questions, they also talk about the targets, that by which year we are going to achieve this particular thing. So hence you have to remember that by 2030. What it does stillbirth means? That means child has born dead. So one is your neonatal mortality rate. Child was alive when he or she was born, but after birth, he or she died because of any kind of circumstances. And stillbirth means child was born dead. So these are the two factors which you want to control by the year 2030. Moving ahead and defining the 6 pillars of intervention, what you are going to do under newborn action plan. Preconception and antenatal care, care during labor, childbirth, immediate care, healthy newborn, care of small sick newborns, and care beyond newborn survival. These are all the things that you will be taking care of. Nothing more than that is needed under this. Next is MA, that is mother's absolute affection. Now what we are trying to do under this is, we are trying to promote, the aim is to promote breastfeeding plus any kind of counseling that is related to it. So this is the only thing that you should be remembering. We want to aware the community, we want to monitor, as well as see it has got many kinds of benefits, and fortunately, unfortunately, the awareness regarding this remains till date very low. So because of that, this particular component has been launched. Now talking about the immunization. At the time of COVID, we have seen that what good role immunization can play. So before COVID-19 vaccines came out, we have seen the havoc that was caused in second wave as well as first wave of COVID, especially in the second wave. Many of us have lost their loved ones. But post the vaccines came out in the market, the death has reduced significantly, and I guess not just me but everyone was thinking that now the world will never remain same, we'll all be going to use mask every day, but that has not been the scene right now, although we should be using it at specific places, but we have come a long way since then. So hence, this is how immunization is so much important. And with these objectives, government is well aware that if you want to have a healthy work population in future ahead, if you want to achieve your economic best, then you should be focusing on your children's. So in that particular sense, government has launched this what you can say mission Indradhanush and all those mission. Here what government does is government provides free vaccines for 12 vaccine preventable diseases, right? Some 9 vaccines they are given nationally and 3 vaccines they are given subnationally. Subnationally means there are certain areas where these diseases are endemic, right? So only in these endemic areas these vaccines are provided compulsorily. I hope you must have heard about Chamki Bukhar. Can you tell me in which area this particular disease is endemic, also known as encephalitis, right? In English we call it encephalitis, in Hindi also called as the Chamki Bukhar. So can you tell me that in which particular state this particular disease is endemic, or we are seeing this particular thing again and again? So let's see, till the time you make a guess, let's start with the immunization thing. First little bit history and then talking about what is government doing over it. So expanded program on immunization, it was launched in the year 1978, renamed as Universal Immunization Program in 1985 when it was expanded beyond urban areas. Right now, since the launch of National Rural Health Mission in the 2005, it has always been an integral part of it. Universal Immunization Program is one of the largest public healthcare program. We all remember polio drops that we had in our childhood, don't we? That is the only childhood memory that I have, and yes, very good Nivedita. It is in Bihar state and we see this every time in the season, right? So hence there are some diseases which are endemic. Endemic means they are now in the environment and after a certain period, after a certain season, we experience it, right? Currently this is the time period of cold, cough, and automatically these are certain things they activated because of the season change. Hence, so in that same pattern we have got these diseases which are endemic. So nationally we provide vaccines for 9 diseases. What are these diseases? Diphtheria, pertussis, tetanus, polio, measles, rubella, severe form of childhood tuberculosis, hepatitis B, meningitis and pneumonia caused by Haemophilus influenza type B, right? Now one more thing, I'll tell you one more thing over here. So diphtheria, tetanus and cough, one is cough and the other one is your Haemophilus influenza type B, as well as your hepatitis B plus cough. So 1, 2, 3, 4, 5. These are the 5 diseases for which we have got a single vaccine. So you will be seeing that particular vaccine, right? These are the 5 vaccine preventable diseases for which we have got one particular vaccine that is going to prevent all of them together. One more thing which I want to give you information about, hepatitis B is the, there are hepatitis related diseases A, B, C, under which hepatitis B you can prevent it through a vaccine. So hence we provide a vaccine for it. Now when the child is considered, and subnationally against 3 diseases. Subnationally means only in the areas where these diseases are endemic. What are these diseases? So rotavirus diarrhea, pneumococcal pneumonia, as well as Japanese encephalitis, that was I was talking about, right? This is in local language it is called as Chamki Bukhar, and it is caused, sometimes it is caused because of eating of a lychee fruit which is not yet ripe. So these are the causes. Now when the child is considered that he is fully immunized, so a child will be fully immunized if he or she receives all due vaccines as per schedule within the first year age of child. So these are the things. Now talking about Mission Indradhanush. Mission Indradhanush has got various variants of it because it was launched in 2014. As the time progresses, we tend to cover a certain area of our society, and then the time comes for the next phases. So Indradhanush 1.0, 2.0, 3.0, like that we have got phases. Because understand this, immunization is a continuous process. You cannot stop it. Every year there are newborns who are taking birth in India, and every year we have to come up with the new strategies, with the new vaccines if any kind of other disease that is coming on horizon, right? For like current example, COVID-19. So like that. So every year is a new challenge where you have to decide your targets every 2 to 3 years, because child are being born every year in the country, and hence the targets also they get shifted on. So this is not just a one-time activity. Any health related activity is not just one time. Talking about Mission Indradhanush, it was launched in 2014, right? What was the aim? Aim was to increase full immunization cover greater than 90% of children who are up to the 2 years of age, as well as to the pregnant women by the year 2020. Now, technical support is of WHO as well as UNICEF. Then pentavalent vaccines. Now, can someone will tell me what is pentavalent vaccines? Pentavalent vaccines. This is 5 in 1. Just now I have told you, when I was covering the vaccines, I have already told you diphtheria, tetanus, hemophilus as well as hepatitis B plus whooping cough. These are the 5 diseases that will be prevented by having this pentavalent vaccines, 5 in 1 vaccines. Next is inactivated polio vaccines, rubella, rotavirus and adult Japanese encephalitis. Technical support will be given by WHO, UNICEF, Rotary International. Catch-up campaign mode aims to cover all the children who have been left out or missed out for immunization. This is our aim. So inactivated polio vaccine is also a new component. Why? Because earlier the polio vaccine that we were consuming or we were having, there was a live polio virus that was weakened, so that our what you can say, our immunization system or our immune system can be trained how to fight with that particular disease. But because of this particular technique, there was a wild polio virus that was occurring in the nature. That is vaccine derived polio virus. It has been seen all over the world, and hence now the vaccines which are being used for the polio, they contain inactivated polio virus in order to prevent any kind of what you can say, wild derived polio cases. You all know that India has been given the title of India is a polio free country, but our neighbors are not yet polio free. Our dear neighbors, you all know them, they are not yet polio free, but India is. So last case was accounted in 2011. After that, no case has been arrived at, and it is very important to maintain this particular status. So let's move up and talk about intensified Mission Indradhanush that was launched in the 2017. Again, now aim is same. You have to cover more than 90% of the eligible population. Who are your eligible population? Child up to the age of 2 years as well as the pregnant ladies. But where? So now your focus is in the pockets of low immunization, the areas where immunization is less. You want to cover all those areas. Next is Mission Indradhanush 2.0, same things. Now here you are going to do full immunization in identified districts as well as urban cities. Nothing new. Same as 3.0, you have identified certain districts where you want to do the coverage. Talking about 4.0, it was launched in 7th Feb 2022. Now what we want to do over here, to catch up on the gaps that might have emerged due to COVID-19 pandemic. Obviously, during the 2-year time period where we have faced pandemic, there were so many lapses that occurred. The all focus of government machinery was to prevent COVID-19 related deaths, to provide health support to all the COVID patients, and in order to stop the COVID prevalence in the society. So these were our aims, and we were not really focusing on the immunization. So any kind of gap that might have occurred because of the COVID-19, we want to cover it, and this was the aim of intensified Mission Indradhanush 4.0. Now coverages, it will have 3 rounds and will be conducted in 416 districts, including 75 districts that have been identified under Azadi Ka Amrit Mahotsav. Next, talking about what has been the real change that was brought on ground due to Mission Indradhanush. This is not very important from the MCQ's perspective, but can be a real good data in order to use for descriptive related papers. So Mission Indradhanush 5th phase, it shows that there has been a 18.5% increase in the full immunization coverage as compared to the National Family Health Survey 4 that was conducted in 2015-16. So NFHS 5, National Family Health Survey 5, it has been conducted during the year 2019-20, and it has shown that full immunization between the age of 12 to 23 months, that means up to the age of 2 years, it has increased from 62% to 76.4%. Now this is an eye-opener for all of us. Instead of having an aim of covering 90%, we still are not up to that particular mark. We still are lagging behind. So what can be cause of this? There can be many causes, like institutional deliveries are not happening in certain pockets of our country. Certain pockets are not having the health related facilities. There are no primary health centers over there. There can be so many things, right? So hence this particular data is less. Now, what are the focused areas? I'll be quickly moving through this because I'm just going to tell you that what are the focus areas. Focus areas means what are the people categories that you are targeting under Mission Indradhanush, right? Not very important, but a little bit information you should be having. So hence, let's cover it. Now, immunization services that got affected due to COVID-19 pandemic, you have to cover all those containment areas. Next, it should prioritize the block, village, mohalla wards such as areas affected during COVID-19 pandemic. Next, non-migratory as well as the migrants who lived in the high-risk areas. Tenants, families who had temporarily migrated to the work. Newborn who was delivered at the home, however, newborn delivered at health facility should not lose focus. Next is villages areas with the vacant sub-centers. So I have told you why you have not been able to increase the immunization up to 90%, because we have seen the COVID-19 pandemic. With some newborns might have got delivered at the home. We have got no data about them. So hence these are the focus areas that are identified to focus in the next phase of the Mission Indradhanush. Hard to reach areas, urban areas like slum areas especially, where high incidence of measles and the other diseases are there. Areas like orphanage, prisons, red light areas, tribal areas and difficult areas which need special focus. Now talking about Pulse Polio program. Started in 1995. See, a very bad thing related to polio is once it happens to anyone, right? So it cannot be prevented later on. There is no cure that we have identified as of now for polio. Even if some kinds of research might have happened, but I do not know in my understanding that there is any kind of cure for polio if it occurs once, right? So hence going forward, of course, we'll be having some kind of researches which will show the prominence to cure this particular disease. But till now, the prevention is the only cure for the polio program, and hence it got started in the 1995. I remember in my childhood, we have seen so many ads. On Sundays, there are polio camps that were being organized to give the drops, right? To give the polio vaccine drops. So they have really bore fruit. See, you have got so much time, you have taken so much time from 1995 till the year 2011, and still we have not stopped with it. So sometimes it happens. See, if you are reading some kind of scheme, we can just go through it, but it it is really good if you just understand the intent behind that particular scheme, what actual change that particular scheme has brought in, because it really connects us to the scheme. Next is vaccination against polio. It started in 1978 with the expanded program on immunization, but in 1995, following up global polio eradication initiative of the WHO, India launched its Pulse Polio with universal immunization program, and we aimed at 100% coverage. No one should be left behind. So this was our aim. Last polio case in our country, it was reported in West Bengal in the year 2011, and in the year 2012, WHO removed India from the list of countries with active endemic wild polio virus transmission. Now talking about the communicable diseases, or how we are going to prevent them. So what happens is, there are so many diseases, like we are going to see some vector-borne diseases are there. They have their seasons, like there is a season of malaria. Why? Because rains and etc. after effects of that, these vectors, they are born. After that, we are witnessing malaria, dengue, and etc. etc. So many kinds of problems. Now, there you must have seen the advertisements on the TV. Sometime I have seen them in my childhood on national television. They show that you should not let the water collect in any kind of empty tin or any kind of tires in order to prevent all of these diseases. So hence, with all that into consideration, India has decided certain aims for itself, that it wants to eradicate malaria or any other kind of vector-borne diseases. So what is important for you in this particular topic is understand that what aims India has taken up, because these are very important. Why we have taken these aims up? Because WHO has taken these aims, right? So in contrast with that, we have taken this particular opportunities or aims for ourselves. National Vector-Borne Disease Control Program. It has got this short form. This will be used many a time, so please remember this: Vector-Borne Disease Control Program. This is subsumed under National Health Mission. This is an umbrella program. What we are doing under this program? So we want to control vector-borne diseases like your malaria, Japanese encephalitis, dengue, chikungunya, kala azar, lymphatic filariasis, and out of 6 diseases, 3 diseases, namely kala azar, lymphatic filariasis, and malaria, these are targeted for elimination. We want to eliminate it. Malaria and kala azar you might be aware of. Talking about lymphatic filariasis, what happens is, in your limbs like your legs etc., they swell and they looks like what you can say. I do not have an image to show you, but you can Google it. So your limbs, they get expanded because of the disease, and it becomes really difficult to move or do any kind of work of daily needs. So these are the problems with it. Now we will see why these diseases are caused and what India has decided to do with them. So first of all, talking about the malaria. This happens because of a parasite of human malaria, Plasmodium vivax and falciparum. These are commonly reported from India. It is a cause for complications and leads to death if not treated immediately, right? So government has launched a program called as the National Framework for Malaria Elimination 2016 to 2030. In these 15 years, we want to eliminate malaria in a phased manner. So what you have to remember in this, please remember what are the 3 diseases that under communicable diseases and vector-borne diseases what India has targeted to eliminate. Now moving forward, what is our aim? So the goal is important. India wants that to achieve 0 indigenous cases of malaria in the country by 2027 and to sustain elimination by 2030. As per this particular elimination program, states, UTs of our country, they are divided into 3 categories for malaria elimination. I have already told you. See, these diseases, they are sometimes geography related as well, right? If I see the western part of our country or eastern part of our country, the diseases which are prevailing in both of these parts, some diseases are obviously common, but some diseases are different as well. because of the nature, the geography, the environment which in people live in. So these are the cases why our country has been divided. National Framework for Malaria Elimination. It was launched by our Honorable Minister of Health on 11th February 2016. What we want to do? We want to eliminate malaria from entire country by the year 2030. Next is National Strategy Plan for Malaria Elimination in India. So obviously, in order to achieve any kind of thing, you have to make a plan, and then hence it particular plan has been made. Again, the same kind of things are being repeated over here, that you want to eliminate the malaria, and then this particular plan has been developed by Directorate of the National Vector Control Program. Now talking about dengue. So dengue is a very painful disease. So it is a fast spreading outbreak prone arboviral disease. It is transmitted by Aedes mosquito, which is a day biting mosquito, and it prefers to rest in hand to find dark areas inside the house, right? At present, it has also been reported to play a role in the southern and northeastern states. What is Aedes albopictus? There is no drug available to cure the dengue infection. So what we actually do is, sometimes you might have seen that if anyone catches dengue, there are obviously medicines in order to treat the symptoms, right? What we do, we treat the symptoms, but at the end of the day, it depends on your immune system, how strong is that, how you are able to cope up with the disease, right? All kinds of support is provided to the person in order to come out from the dengue, but there is no specific medicine that has been made to cure this particular disease. Next, talking about lymphatic filariasis. So the definition is to achieve 1% microfilaria rate in the endemic areas. Global target is elimination as a public health problem by 2030. India has said that we will be eliminating by 2027, 3 years ahead of the global target. Multi-drug administration campaign twice a year synchronized with deworming day. These are the programs that have been taken in order to control this particular disease. Now talking about Kala Azar. Kala Azar or visceral leishmaniasis is a complex disease caused by parasite leishmania and is transmitted by female sandfly, Phlebotomus argentipes. So what happens in this is, what are the parasites? So parasites are the living beings, we can call them as living beings, because they live on the blood or the supply of nutrients from an host, right? So there is a person or any kind of mosquito or a sandfly, they live in them, they take nutrients as well as other kinds of services that they need for their growth. So these are called as parasites who live because of their host. So these parasites actually are the responsible. Sandflies are not responsible for the diseases. Parasites are the ones which are responsible for this disease. This disease is fatal if it is not being treated timely. Now, Kala Azar cases are mainly reported from 4 states, that is Bihar, West Bengal, UP as well as the Jharkhand. Now what are the achievements? So India wants to eliminate this particular disease from India by the year 2023. 99.8% endemic blocks, they have already achieved elimination status. Only one block of Pakur district, Jharkhand is in the endemic category population. Now talking about the Japanese encephalitis. It is a zoonotic disease which is transferred by a vector mosquito mainly belonging to Culex vishnui group. Transmission is maintained in the nature by animal reservoir like pigs, water birds, etc. Man is the dead end host. Dead end host means man cannot transmit it further. So it is not transmitted from one infected person to the another, and around 50 to 80% of the disease burden, Assam, Bihar, very prominent, Tamil Nadu, Uttar Pradesh as well as the West Bengal. So all the nearby areas along with the Bihar, these are the areas where you will be witnessing Japanese encephalitis. Next is chikungunya. heard the name of this disease before the year 2008. 2008 or 2009 was the time period when we heard of this particular disease for the first time. Do you guys agree? Means I have not heard this particular disease before 2009. So I guess this was a relatively new kind of disease. Prevention and control of dengue as well as chikungunya is one of the components of National Vector-Borne Disease Control Program. It is a non-fatal viral illness caused by chikungunya virus. Disease re-emerged in the country after a gap of 3 decades. Oh, fine. Now, strategies. What are the strategies do we have in order to fight with all these diseases? So number one is surveillance. Obviously, check out what are the areas that are endemic and then coming up with the schemes as well as the preventive measures for them. Case management, vector management, that means environmental management for source reduction, outbreak responses, as well as capacity building, training, operational research, etc. So these are the general things which we do for any kind of disease in per se. We want to find out, see, if I sum up all of these, what are the steps that are taken by us? We want to find out that what are the endemic areas. We want to do the search that why these areas are endemic, what are the cause. There must be some sanitation related problems, some health related problems, some immunization related problems, right? One of them might be the thing. So if there are the problem, first identify the problem area, then do the solution according to that. If you need more manpower, if you need the training for that, if you want to establish a separate department for doing the research that why these disease is particularly in this particular area prevailing. So these are all the things that we do in order to prevent any kind of disease. Now talking about revised National TB Control Program. So this is a out of syllabus thing, but I would like to ask, do you guys understand that what is the difference between a virus related disease and bacteria related disease? We differentiate accordingly that. Can we have a vaccine for bacteria related disease? Any answers? Okay. So, see, there are diseases which are caused by the virus and there are diseases which are caused by the bacteria, like the TB, tuberculosis, that has been caused by a bacteria. So this is just a topic of general discussion. No, there is a difference in their structure. We are not going to discuss that because again, COVID-19 was a virus. Hence, we created a vaccine for it, right? So vaccines are more effective if the disease is because of the virus. So, there have been the researches that has been done so that we can make vaccines for other type of hosts as well, but these are not much effective. So please remember that vaccines are most effective when the disease has been caused by the virus. In case of TB, we will see that a particular course it is required and you have to complete that particular course of medicines in order to prevent yourself or cure yourself from TB. Now, to decrease the mortality and morbidity due to TB and cut transmission of infection until it becomes a major public health issue. This is the key initiative, has been in the news quite some time, right? It was launched in the country, across country in the year 2011 with 98% of the reporting units sending in case-based reporting of TB patients. Nikshay Poshan Yojana launched in 2018. This is a central sector scheme. It provides direct benefit transfer of 500 per month for the nutritional support of the TB patients. Now let's see what are the prevention related things that we have done in India. So there was a national strategy plan for TB elimination in India, right? Target is we want to eliminate the TB from India by the year 2025, to strategically reduce TB burden in India by 2025 5 years ahead of Sustainable Development Goal. And as per that, we have integrated 4 strategic pillars: detect, treat, prevent and build. The government has targeted that SDG targets with regard to TB are 80% reduction in the incidence and 90% reduction in the mortality. Now TB is very much, what you can say, it is a communicable disease, because if a person has got TB and he coughs and sneezes any kind of things, if he does in the general environment, then there are droplets coming out of his or her mouth and they can cause TB to another person as well, right? So hence prevention is very important, and that's why it is being said that whenever you are coughing or sneezing, please keep a handkerchief. So next is Pradhan Mantri TB Mukt Bharat Abhiyan. President of India, Srimati Draupadi Murmu, she virtually launched the Pradhan Mantri TB Mukt Bharat Abhiyan on September 9, 2022. What we want to do, we want to provide additional patient support to improve treatment outcomes of the TB patients, and for that we want to leverage corporate social responsibility activities. So in India, if you are a corporate, you are earning profits by using societal resources, then you have got. So yeah, we will be providing more videos of ISCA. We'll be coming with that. I have been informed that from today onwards we are going to conduct the classes, right? Mostly from today onwards. If there will be any change, then that will be communicated. Fine. So CSR activities, if you are a corporate, you are using society's resources and you are making profits, then you have to give a certain percentage of your profit for the development of society. And let me tell you that our corporates in India, whatever corporate social responsibility is being collected, these have been spent on 2 areas predominantly, called as education and health. So these are the 2 areas which are receiving more the ultimate level of support from our corporate entities. Next is National Leprosy Eradication Program. So this was again a very bad disease. Again, a communicable disease, can be transferred like from touching and all, right? And there was earlier new cure for this in the earlier times. Now we want to eradicate this particular thing. National Leprosy Eradication Program, it is a centrally sponsored scheme under the umbrella of National Health Mission. What are the objectives? We want to reduce the prevalence less than 1 per 10,000 of population. Grade 2 disabilities less than 1%. Grade 2 disabilities cases 1 case per million population at the national level, and 0 disabilities for the child. Zero stigma and discrimination against the persons who are affected by the leprosy. Now talking about National AIDS Control Program. There was a recent, what you can say, there was a recent news related to AIDS in the research thing. Have you guys heard about it? That a stem cell therapy, there was a particular person who has been cured from AIDS because of the stem cell therapy. This was the news. So finally, there are some ray of hopes in the prevention of AIDS as well as cure of AIDS, because till now we were not having any kind of cure for this particular disease. It is going to take some more years to develop a fully functional, what you can say, curing program for this particular disease, but yes, that breakthrough has already been made. National AIDS Control Program we have launched in the 1992. Why this is being called control program? Because the time it was launched, we have not seen any particular kind of cure for that. So the only strategy that we could have made is control the thing. Now history is comprehensive program for prevention and control of HIV AIDS in India. National AIDS Control Organization, it has implemented 4 phases of this particular program, including the extended phase, and currently we are having the phase 5th that is running from April 21 to April 26 under the implementation of 100% central sector scheme. Next, National Strategy Plan that we have made 2017 to 2024, goal of 3 zeros. 0 new infections, zero AIDS related deaths, as well as the zero discrimination, accelerated progress towards achieving ending of AIDS by 2030. So in India, AIDS is prevalent. AIDS is not an endemic disease, right? It is not caused by the environmental factors. It is obviously caused by the human related factors and other things. But in India, I'm not generalizing it, but most of the times the disease is, if you see the prevalence of the disease, it is in other states as well, but it is quite high in the northeastern states as per the government data. So in order to cure that, Mission Sampark, it was launched to trace those who are left to follow up and are to be brought under the antiretroviral therapy services. Antiretroviral, see what happens in this particular disease is, this disease leads to weakening of your immune system over the time. So hence these therapies, these are given in order to restore your immune system. Not up to the mark, but yes, they can increase the longevity of life. If you were, I'm sorry to say this, but if any person who has got infected with AIDS, if he was supposed to die in 35 years in the previous times or in the older times, now we can increase the lifespan by a few years by giving this particular therapy to him or her. It will aid in fast tracking the identification of all who were HIV positives and subsequently linking to the ART program. Please remember, ART, that means antiretroviral therapy, these are given in relation to the prevention and cure of HIV AIDS. It is an AIDS Project Sunrise. Please understand this and please keep in your mind. It is an AIDS prevention special program for the Northeast. I have already told you, we are not generalizing this thing, and anyone who is from Northeast watching this, please don't think otherwise, but these are the diseases. It is, again I'm telling, it is not an endemic disease. It has got no relation with the environment, nothing, right? It is being implemented in the 20 districts of the 8 states, 7 sisters plus Sikkim, with an aim to diagnose 90% of the drug addicts with HIV and put them under the treatment by 2020. It is steered by NACO, that means your AIDS Control Organization. And now you also know why this particular disease is there. HIV AIDS Prevention and Control Act came into force 2018. What we want to do? We want to prevent the HIV and AIDS. Next is National AIDS and STD Control Program Phase 5. Union Cabinet, they have approved continuation of this particular program. What will be the duration? From 2021 to 2026. Outlay is 15,000 crores. And target is, we want to attain UN SDG goal 3.3 of ending the HIV AIDS endemic as a public health threat by the 2030 through a comprehensive package of prevention, detection as well as the treatment related services. Other schemes under National Health Mission. A little bit introduction, just remember the name and the aim of the scheme, what they try to do, that will be enough. Even Electronic Vaccine Intelligence Network, made during the time of COVID. So real-time visibility of stock and temperature of cold chain equipments across the country, with Global Alliance for Vaccine and Immunization as well as health system strengthening support, it has been implemented. Next is Dakshata program. It is a strategic initiative to improve the quality of intra and immediate postpartum care. Strengthen the competence of providing labor room. Duration of training will be 3 days. Implementing in district level facilities. One district level facility will be designated as training. See, there are many complications which women experience after giving birth. So what you have to remember under this is a training program, capacity building program, and we have got a special focus. That means we want to provide immediate postpartum care. That means once women give the birth after that, because there can be many complications that can occur. Tell me, when we read about maternal mortality rate, till what day maternal mortality rate is considered to be taken? We have talked about it, right? So if a mother dies during the time of giving birth or after how many days of giving birth? Please recall that, remember this. Next is NHM Health Statistics Information Portal. So what we going to do over this portal? It will be your gateway to a wealth of information regarding health indicators of India. It is being compiled from Health Management Information System, district level household surveys, census, performance statistics, and all of this. At the end of the day, this particular health statistic information portal is going to provide you all the health related data that is currently in our country, and you can see this. You can do the policy formation by help of this particular data. Next is Kilkari Initiative. What Kilkari Initiative is all about? Largest maternal messaging service in world. Free weekly audio messages about pregnancy, childbirth, how to do childcare, etc. Next is Kayakalp Award Scheme launched under the Swachh Bharat Abhiyan. Within 7 years of its implementation, Kayakalp has been able to facelift the public health facilities appearance. See, Swachh Bharat has to be Swachh from every angle. By keeping that particular thing in mind, please remember Kayakalp Award is given under which particular mission? That is under Swachh Bharat, and it is related to the health facilities as well. National Deworming Initiative. Deworming initiatives are intestinal worms, and it basically attacks the child. You might have seen that, you might have heard in Hindi that पेट में कीड़े पड़ जाते हैं. These are those worms, right? Intestinal worms. They are having a severe impact on the nutritional as well as development indicators of the child. Because of them, child may experience stunting. Child may experience wasting. Stunting, wasting means having a low height, low weight as according to the age. And so many other nutritional disadvantages can occur. So these are the large multicellular organisms which can generally be seen with the naked eyes. These are also called as the helminths, aimed at the children up to the age of 19 years. This is the particular tablet which is given. Albendazole tablets, these are part of this particular scheme. Who are going to implement them? So all this related ministry, Ministry of Health, Ministry of Education, Ministry of Women and Child Development, these are collaborating under this. Next is Navjat Shishu Suraksha Karyakram. Navjat Shishu Suraksha Karyakram, training health personals in basic newborn care for prevention of hypothermia, infection, early initiation of breastfeeding as well as basic newborn resuscitation. So these are all the things that will be taken care under the Navjat Shishu Suraksha Karyakram. We want to address these, but the basic aim of this particular program is we want to train health personals. You might have seen that there are so many programs on the newborn child, but if you read carefully, the ultimate objectives or all of these particular schemes will be the same, right? To prevent the child care related infection, diseases, etc. But if you will see carefully, the aims of all these schemes are different. What they want to do, in some schemes we want to support the mother and child, right? In some schemes we want to do the capacity building. In some schemes we want to train the personals over there. So please read carefully. You might see that objectives are the same or the end objective is the same, but if you will find it carefully, you will be able to see that what are the real aims of these particular schemes, right? Now the next thing which we have got is National Health Policy, and we'll not be covering it today, we'll be covering it tomorrow. Okay, so this is it in this particular class. Thank you so much for watching it.